Welcome back. So it is Women's Month, and as we continue to focus on women's rights in the wake of our National Women's Day, we look at healthcare rights today. Various international forums have declared that women's health and reproductive rights are linked. Well, the Cancer Alliance has called for government to urgently address cancer backlogs in the country. To unpack this, we are now joined by Salome Meyer, who is the Cancer Alliance's chairperson. Salome, good afternoon to you, and thank you so much for joining us. Unfortunately, this is such an important discussion for women in South Africa, and I almost want you to paint a picture of just how serious the situation is for women. So what the data is, right? The top cancers for women, and also what those numbers look like on an annual basis.
Good afternoon to you and specifically all the women out there listening to us this afternoon. So yeah, in South Africa, breast cancer is still our leading cancer, and then followed obviously by cervical cancer. However, when we come to the death rates, we will see that cervical cancer is the leading cause of death of women, and then followed by breast cancer. So in breast cancer, we have around, I want to say, let's talk about 11,000 women that are newly diagnosed per year. And for cervical cancer, we have in the vicinity of 8,000 women. The alarming thing that we need to actually ask ourselves within Women's Month and within the rights of women is the whole aspect of access and how accessible are these services. When we start talking about our women that are accessing it in the public health sector, that means your primary health care centers. That's where we need to ask the question, and that's where the biggest inequities in this country really is. Yeah. So women that live in rural areas have to walk far to go to, first of all, to get to a clinic. And then we also need to say to ourselves, if we look at the cervical cancer policy, particularly, a woman is only entitled to a pap smear as of the age of 30 years onwards, three smears per every 10 years. However, we are seeing women as young as 33-year-old dying of cervical cancer. Then we need to ask ourselves the question, what are we doing wrong with the policy? Are we allowing our women to, in fact, be screened at an earlier age when we as a country have alarmingly high teenage pregnancy rates? As well as a very high gender-based violence rate and sexual abuse rate in this country. And those are the kind of things we need to actually start looking at when we are looking at health and from a rights perspective. And it's very difficult, I want to say, issues that we need to start grappling with as we move, and I want to say move out of an era where we're only focusing on HIV and AIDS and TB.
Yeah, because I think the numbers are really quite startling. I mean, you talk about 11,000 per year of breast cancer diagnoses, 8,000 women per year for cervical cancer. But I just want you to help me with the clarity here a little bit, because the Cancer Association of South Africa says, of course, the top three cancers are breast, cervical, and colorectal cancer. But according to their data, they estimate that these three cancers caused over 170 female deaths in South Africa in 2020. I mean, that's an astronomical number. So what's the mismatch that you're seeing there? 8,000 diagnoses. I mean, even if I were to even speak at an average at the top of my mind, I'm thinking at perhaps 40,000 diagnoses per year, and that's off the top of my head. But how does that compare with 170,000 deaths in 1 year, that being 2020?
That would then be for all cancers,
right?
You know, that those deaths are there. And I think what the startling reality is that most of women, and if we're only focusing on women, but the same is in fact for men as well. But most of people diagnosed with cancers are diagnosed in, I want to say, in the public sector, but are then also linked to late-stage diagnosis. And late-stage diagnosis, that means stage 3, stage 4 cancers, which is very challenging to actually manage.
Yeah.
And some, it is then too late, and that's why you then have a very high death rate with regards to certain cancers. And we can prevent that if we actually say to ourselves and just realize cervical cancer is the most preventable cancer of all cancers. Why? Because it is caused by a virus. There is a vaccine. We have got a vaccination program. However, what we need to do is we really need to start focusing on our screening and treatment aspect of the elimination targets.
Yeah.
And those are the kind of things that we need to start looking at. We have an excellent breast cancer policy for this country. However, the policy is not implemented at provincial levels due to a lack of funding. And that is where there needs to be a collaboration between the policymakers as well as the decision makers in terms of funding and the allocation of funding. It's all good and well to have policies, but if your policy is not implemented and the woman who is actually demanding her health rights under the Constitution cannot demand those rights because the province is not allocating enough money for screening or treatment services in the provinces. And those are the mismatches in our current health system.
I mean, if you speak about a mismatch, that really is something quite startling, right? That you say the challenge here is the resources, the money that's necessary, yet the Cancer Alliance is taking the Gauteng Department of Health to court over an unspent 784 million rand. So there is money that's not being used, but there isn't money that's reaching people. I mean, how do you explain that? And really, what are the steps that can be taken to deal with it? Because it certainly is one thing to take the Gauteng Department of Health to court, but you've got thousands of women who are desperate for that treatment that is, you know, the difference between life and death for them. So what's the lower hanging fruit here?
What we really need to start focusing on is our primary healthcare services, that we can actually, where we can reach women at the lower end, I want to say, of the chain, where we can pick up our cancers at a much earlier stage, where it isn't as costly to manage them in terms of their cancers. By the time they are then referred back into the system for treatment, that's when it becomes challenging and also very expensive. And what we do find is that there is not an integrative service. What do we mean with that? From primary health care to the secondary, tertiary treatment hospitals, and then back to the community is one treatment journey. However, at the moment, those services are all managed in silos within the provinces. Therefore, primary healthcare services manages themselves and they've got their own program, but that must be feeding towards the screening as well as the diagnosis and treatment at a higher level, tertiary level. There is no linkages, and that's where the bottlenecks are happening, and that is very particularly what happened in Gauteng. So it doesn't help that you screen when you cannot treat. In fact, that is really, I want to say, criminal that you do that you screen a woman, and then on the other hand, you allow that woman to be waiting for treatment that could save her life for 3 years. And that is, in fact, one of the reasons why we are so adamant about our case in Gauteng, because we need to go back to the Subramani case many years ago. And in that case, the court basically said, if there is no money to do the service, meaning government, you can't hold government responsible. In the Gauteng case, what we have seen is that Gauteng Treasury actually awarded the money to the Gauteng Health Department and said to them, here's your money, go and do your job.
Yeah.
They haven't done that. And that is a violation of a health right.